Good day everyone, I am Kathleen Roquillo, a student nurse from Davao Doctors College BSN 11K, and I'll be performing a return demonstration of administering oral medications. Oral administration is the most common, least expensive, and most convenient route of administration for patients. In doing so, it is important to remember and adhere to the 10 rights of medication administration to avoid making errors and ensure client safety and well-being. The 10 rights of medication administration include right medication, right dose, right time, right route, right client education, right documentation, right to refuse, right assessment, and right evaluation. Before we start, don't forget to perform medical hand washing. Prior to conduct the procedure, the first thing to do is to check the physician's order to know what medication should be given to the assigned physician. Now, check the MAR or the medication administration record with the physician's order for drug name, frequency, dosage, and route of administration. And next is we have to verify the client's ability to take medication orally. Now, organize supplies and bring the requisites to the preparation area. The requisites include a medicine cup, we have the medicine tray, we also have the, if deemed necessary, stethoscope and sphygmomanometer. Next is we have to perform hand hygiene to deter the spread of microorganisms. Now, read the MAR, take the appropriate medicine in the box, read label, and removes medicine from the box. Compare the label of the medication against the order on the MAR of the computer printout. Now check or recheck the label of the medicine with the MAR and also note for the expiration date. Now, for liquids or suspensions, first is thoroughly mix the medication, remove the cup and place it upside down onto the countertop. Hold the bottle so the label is next to your palm and pour the medication away from the label. Okay, so assuming that this is the ascorbic acid and this is the paracetamol. So first, we need to get the ascorbic acid. Then, shake it thoroughly. And then put it here back to the box. And now we have the ascorbic acid. Okay, so before capping the bottle, we have to wipe the rim of the bottle first with a paper towel or tissue paper. Okay, so for the drops, using a medicine dropper, draw the amount needed of the medicine and place filled medicine dropper inside the medicine cup. So you have to shake this first. Two drops. Okay. Then we have to wipe the rim of the bottle. Okay, so for the introductory phase, first is we have to introduce self to the client at each client's bedside. Identify client by asking client to the state of his full name or checking the wrist hand. So this is done to establish rapport and ensure that I have the correct patient that I am assessing. Okay, ma'am, so good day. I am Catherine Roquillo, your student nurse for today. So before we start, I would like to verify your identity. So please state your name, ma'am.
I'm Precious May Bacolod.
Okay, so please state your birthday.
December 29, 2001.
Alright, ma'am. Next, I will explain the procedure to the client, how he or she can participate during the assessment, and provide the client the opportunity to clarify or ask any concern. So this is done to elicit cooperation from the client, so ask the client for any allergy. Okay, ma'am, so how would you like to address me during our assessment?
Just call me Precious.
Alright, Ma'am Precious. So, okay, so for now, Ma'am Precious, before we start, I would like to explain why I'm going to give you the medications. Okay, so for now is I am going to give you your medications as ordered by your attending physicians, Dr. Rodriguez. And may I ask if you are aware of any allergy of medications or drugs?
No, I don't have any experience of allergies in drugs and medication.
Alright, ma'am. Okay, so for now, ma'am, do you have any questions or clarifications or any concerns with our assessment today?
None so far.
Alright. If the medication to be given is highly acidic, such as aspirin, it can be given with a snack such as crackers if food is not contraindicated. Now at client's bedside, match up the MAR with the names of the medication as shown on their labels and with the client's name. If needed, perform the pre-administration assessments such as taking blood pressure, pulse rate, or respiration rate. Okay, ma'am, so before we begin, I would like to do the pre-assessment by getting your blood pressure and your pulse rate, right? So, first is I'm going to get your pulse rate. Alright, ma'am. Okay, so next one is I'm going to get your blood pressure. Okay, ma'am, so your blood pressure is 120 over 89, which means normal. Okay. Next is, we have to discuss the purpose of each medication, including relevant information, such its action, its possible side effects. Okay, Ma'am Precious. So Dr. Rodriguez has prescribed you with ascorbic acid or the Secon. So its generic name is vitamin C. It helps your body needs to form blood vessels, your cartilage, your muscle, and collagen to form in bones. This is also called the vital to your body's healing process, with a dosage of 500 milligrams to be taken once a day. And it is in a tablet form, which means that you have to take it orally. Then the next is paracetamol. Its generic name is acetaminophen. It is used in the treatment of mild pain, such as headache and pain in joints and muscles, to reduce fever, with a dosage of 500 milligrams as well, to be taken once a day. And it is in the liquid form, which means you have to take it orally. And the doctor also prescribed you with the Solmux. Its generic name is Carbocisteine, with a dosage of 500 milligrams with 2 drops, to be taken once a day. And it is in the syrup form, so you also have to take it orally. Okay. So the purpose of the Solmux is to treat cough and remove phlegm and bacteria. Okay. Next is assist the client to sit or to sit lying position. Okay, ma'am. So are you comfortable in your position when taking the medication?
I prefer to sit down.
Okay. So please sit down. All right. So. Okay, so next is administer the medicine to the client and give the client sufficient water or prefer juice to swallow the medication. Okay, ma'am. So here is your ascorbic acid or your vitamin C. Okay, here's the water. Okay, next is. Here is your paracetamol. Okay. You can also drink water. Okay. And last is your Solmux. Alright. Stay with the client until all the medications have been swallowed. Okay, ma'am, so good job. Now that you're done taking your medications, I have to leave you now so that you can take your rest. So before I leave, do you have anything or do you like anything that you would like me to do?
None.
Alright, ma'am. So I'll be back after a few minutes to check up on you, okay? Alright, so thank you for your cooperation, my precious.
Thank you.
Okay, so now that I'm done with the administration of the medications to the patient, I'll now proceed to the documentation process of the procedure I've done earlier. So the documentation includes the medication given, the route, and the time of medication was given. So I have given the patient 3 types of drug as per doctor's order. So the first drug is the ascorbic acid or the Secon drug with a generic name of vitamin C with a dosage of 500 milligrams. For the frequency, it would be taken once a day. Then the second one is we have the paracetamol with a generic name of acetaminophen with a dosage of 500 milligrams. For the frequency, it would be taken once a day. And for the third one is we have the Solmux with a generic name of Carbocisteine with a dosage of 400 milligrams with 2 drops. And for the frequency, it is to be taken once a day. Now, I also include the documentation for any complaints or assessment of the patient and if the medication has been refused or omitted. Then also, documentation for any reason omission. And also never forget to affix your signature on the documentation sheet, which signifies that you have carried out the doctor's order. Replenish the stocks, such as medication cups, and return the card to its appropriate place. And lastly, perform aftercare of the equipment used by using soap, rinsing, and drying them and return them to its proper place. Now that's it for my return demonstration. Again, I am Catherine Ronquillo. Thank you for watching and see you in my next video.